Good evening friends. Today I am going to show you how I implant a 3-piece acrylic foldable intraocular lens into the bag. This is my technique, which is slightly different from how I used to do before. Now after having done the phacoemulsification, I always put enough viscoelastic within the anterior chamber to inflate the bag so that there is adequate space, and at the same time I use the tip to polish the posterior capsule if cortical matters on the posterior capsule. Now I have done a 2.2 millimeter phaco, so I have enlarged the incision to 2.8 for implantation of a 3-piece acrylic Sensar AR40 lens. This is how I load the lens in the cartridge. Now I make sure the trailing haptic is out of the cartridge on the side of the injector. It's a screw type of injector. I use an iris spatula on the left hand, slowly inject the tip of the cartridge, make sure that I reach the center of the bag, and that's how I slowly unfold the lens, make sure that the optic has opened fully. Here is the catch. I wait for a few seconds till the optic opens fully, and that's how I am waiting. After I see that optic has opened, I take back the plunger and slowly engage the tip of the trailing haptic on the tip of the plunger and inject the lens in the bag. This is my way of implanting the lens, and in most of the cases it sits quietly and quite well centered within the bag. This I feel is a very good technique in most of the cases. Otherwise we need to ultimately inject the lens, half the trailing haptic into the outside the wound, and then dial the lens in the bag.